it's such an honor for Rolling Out to be able to partner with the Black Women's Health Imperative. So first of all, Linda, I want to thank you for putting this conversation together and for including Rolling Out. What an amazing way to really honor World AIDS Day. And so I want to first of all, allow you to say a few words about how important this is for Black Women's Health Imperative.
Well, Crystal, thank you so much. I mean, we love Rolling Out. We love to partner with you all because what we need is that trusted voice in the community. So Black women and all women know where to go for the real news, for the truth, for honesty, especially around our health, because there's so much out there that could lead us astray and is intended to do so. So we know Rolling Out is a source of truth. We also know the Black Women's Health Imperative is a source of truth for accurate healthcare, for research, for data, for policy, for what we need to be as healthy as we can, to be as informed as we can, to help each other be as healthy as possible. And so today, World AIDS Day, there's just no better day than to talk about an issue which is very complex, has a lot of misinformation around it, a lot of negative stereotypes, none of which is necessary, so that we can all bring together the truth and also resources to help Black women every day make the best decisions for their healthcare, know where to go, know who to trust, who to listen to, and to take care of themselves. So I couldn't be more excited to be here with these two experts on this as well. And I'm so excited and looking forward to the conversation.
Absolutely. Well, again, I want to welcome all the people that are joining us and thank them for joining as well. This is World AIDS Day, and this is an honor for Rolling Out to be able to partner with Black Women's Health Imperative for the second or third year, us being able to have this conversation. Now, we realize that the conversation around HIV and AIDS it's no longer maybe on trend, and so people don't hear the statistics. But when you think about the fact that about 1/5 of new HIV infections in 2021 after the pandemic were among women, and over half of those were Black women. And considering that we make up only 11% of women, we realize those numbers are completely inflated. And so I want to start with you, Dr. Rice. What is the current state of Black women's sexual health? Hearing those statistics can be, a little bit alarming, but what is the current state, and what are we dealing with right now?
Thank you for your question. I think you've highlighted some of the key statistics relating to HIV, but I think in addition to that, we certainly know that Black women are disproportionately affected for a variety of reasons. That has to do with our ability to access care, but also the policy environments that we live within that enable or make it less likely that we access care for a variety of reasons. And so some of the data that we know has to do with the fact that we're not only disproportionately affected by HIV, but other related STIs, that we are less likely to benefit from some of the preventive tools that are at our disposal, or should be, I should say, including HIV pre-exposure prophylaxis, and that, compared to males in the country, we are less likely to be prescribed PrEP relative to males. And so I think there are a number of structural factors that are reflected in that data that include the fact that we sort of have a patchwork of access to some of the critical resources for accessing care, like certain forms of health insurance. A good proportion of our U.S. population relies on Medicaid, for example, and Medicaid covers a number of important HIV-related services, and not only things that we're interested in, like that we're talking about, like testing and preventive services, but also HIV-related treatment, and then the things that enable our ability to take advantage of treatment and prevention, so mental health related care and other related forms of care. I think not having some of those critical supports is important, and also the patchwork of things like our access to sex ed is another critical piece of importance that I can say more about, but I will stop there as I know we have plenty more to dive into.
Well, I actually want to stay right there because you mentioned PrEP, and I do believe that there is a huge there's misinformation about PrEP because a lot of people, self included, I did not know until recently that that is something that women can benefit from as well. So I want to ask you, Linda, can you speak a little bit about the I Am HIV Possible campaign that was recently launched to kind of raise awareness about PrEP uptake for Black women?
Yeah, I'd be excited to do that. As was mentioned, we know how to prevent HIV infections, pre-exposure prophylaxis. What's interesting and disheartening to some degree is that Black women are much less likely to be offered PrEP as compared to white men, for example. And yet we certainly can benefit from PrEP. And it's I say disheartening because that means we're not getting the standard of care when it comes to reproductive health and the comprehensive set of reproductive health services. So what we at BWHI have been trying to do is obviously to change that, to get healthcare providers to offer PrEP to Black women. If you're sexually active, then you are a candidate for PrEP. And that's why we launched I Am HIV Possible, because if you are sexually active, then you can be exposed to HIV. So by building awareness about how HIV is transmitted, about how it is prevented, we are helping women understand that there's nothing negative about sexual activity, but if you're going to be sexually active, protect yourself. And there are ways to do that. So you can go to our website. We have another large consortium called On Our Own Terms. So if you go to oot.bwhi.org, and we'll talk about that later, but you can get all of the information you need about how to protect yourself. And when we look at I Am HIV Possible, it doesn't matter if you're a teenager, middle age, menopausal. We've got resources for everyone, and we need women to understand no matter what age you are, if you're sexually active, you could be exposed to HIV and you can protect yourself.
That is good information. I see people in the chat are saying that these are facts that are needed, and I had not heard that myself. So that's really important to be a part of, like the common. We need to normalize this in the conversation. Dr. Fanfare, so we're talking about this it's World AIDS Day. We know that we're having this conversation now. Thankful for this conversation, but how can we leverage these conversations to really make sure that Black women are an active part of the HIV conversation moving forward?
Well, I think on World AIDS Day, it's so important to start with the obvious, but a lot of people seem not to know that we can't protect the health of the nation if we don't protect the health of Black women. So I'm so grateful to be a part of this conversation and make sure that we are centered in this conversation on World AIDS Day. A lot has been said specifically about PrEP. So I'd love to just highlight a few of the numbers, right? So 15% of females who have an indication for PrEP have been prescribed PrEP, and that's compared to 40% for males. Only 13% of Black people with an indication of PrEP have been prescribed it, and that's compared to 94% for white people. So clearly we have very substantial, severe, and unacceptable disparities that exist. I'd also love to highlight something from our space, similar to what we just talked about. We have hashtag She's Well, because when we were out there, we heard, just as you said, Crystal, so many people didn't realize, wait, PrEP is for me? So we thought it was so important and have a for us, by us campaign where Black women can hear and see from each other about the importance of PrEP. When we're talking about our sexual health is wealth, and PrEP really is an act of self-love.
That's huge. That is huge. And hearing this, it seems like we are always on the other side. We're always on the side of there being a disparity, specifically as Black women, as the community as a whole, but specifically as Black women, so many issues that we deal with. I was having a conversation with Dr. Jackie, who was an OBGYN, and she was talking about when it comes to reproductive health, there's so much that we are not educated about, and we don't have necessarily access to quality health care. And so I actually want to ask both of you, Dr. Rice and Dr. Fanfare, to answer this question as what do you see is the intersection of reproductive justice and HIV? Like how do we start to bring these two things together so that Black women are becoming more educated and then have access and make that a part of, like we're proactive as a community to making sure this happens?
Well, I'll start and say it's so important, as you're alluding to, Crystal, that we normalize these conversations. I think
Mhm,
that will really help us break down some of the stigma that
mhm,
still exists. Women face more HIV stigma compared to males. So that's really important.
mhm,
One thing that we have here at CDC that I'd love to elevate and I want to see more nationally is something called Her Prep. We want to get into spaces as Black women, we intersect with the health community all the time. It just might not be in infectious disease or HIV spaces, but we're seeing family planning clinics or sexual health clinics or our internists and family planning. So we want to ensure that HIV testing and PrEP and linkage to treatment services are occurring in those spaces where we already are. You talk about reproductive justice. I do want to bring us right back to what we were talking about with the statistics, congenital
mhm,
syphilis. We've seen
mhm,
congenital syphilis has now 10 times what it was over the past 10 years. And who do you think those babies are that are being impacted? There are babies. And so
mhm.
there's really a large intersection between HIV, sexual health, and reproductive justice that we need to continue to uplift and center so that we can do our part to help break down these disparities.
Dr. Rice?
Yeah. Adding to Dr. Fanfare's comments, I think there are so many important issues at the intersection of reproductive justice and HIV. And we talked a bit about some of the issues that I think sometimes people tend to think about reproductive justice focusing on different specific points in our reproductive lives. But I think HIV prevention and treatment are things that we can think about across our reproductive lifespans as critically important. I think we commonly think of reproductive justice as referring to human rights surrounding having a child, not having a child,
Mhm,
parenting in safe environments, and the right to healthy sexuality has also been talked about in that
mhm,
context as conceptualized by several Black women who coined this lens. And I just want to touch on, that right to have a child and parent safely. And studies have found that HIV is one of many other chronic conditions that can contribute to higher rates of maternal pregnancy complications as well as maternal mortality compared to those not living with these conditions. And I think Black women, regardless of condition, should benefit from the same high quality health and community care that would
mhm,
allow us to prevent chronic conditions when possible, otherwise detect them early, effectively manage them, and then also be in care environments that respect, listen to us, honor our preferences. And
mhm,
we don't always see this as a reality. And
mhm,
we are more likely to live in areas with healthcare deserts that don't have policies in place that comprehensively support our reproductive health and birthing. And so I just want to highlight that organizations involved in lives like Black Women's Health Imperative and others have policy agendas, ones by Black Women's Health Imperative, by Black Mamas Matter Alliance, and others that highlight some of what getting closer to achieving reproductive justice could look like if we had the proper supports.
Yeah. And
I love that.
and
There was,
Crystal, if I could just add, because these are great points, but people
mhm,
also need to know that HIV is also a social and political and economic issue. If
mhm,
we didn't have the gross income inequality that we have, if we didn't have women living in poverty, if women actually had access, then they wouldn't be forced to make choices, which Black women do, to take care of their families, for example. So
mhm,
that means they may have to stay in a relationship that they don't want to be in because their
mhm,
first order priority is their children. And so
mhm.
because of these justice issues, we often are forced to make some very tough choices that hurt our health because we're trying to protect the health of others.
Yeah. Absolutely. Well, I just want to say there was a wonderful comment that said Black women saving Black women. And that's what this conversation
That's
is
right.
all about. If you're just joining, my name is Crystal Jordan. I'm editor for Rolling Out Magazine. And I'm so honored to be here with these amazing women. Right here next to me, we have Dr. Robin Neblett Fanfare, who is the acting division director of the Division of HIV Prevention. Also down beneath her, we have Linda Goler Blount, who is the president of Black Women's Health Imperative, that we're so honored and thankful for them involving us in this conversation. And next to her is Dr. Whitney Rice. She is the director for the Center of Reproductive Health in the Southeast here at Emory University. And we are having a conversation here on World AIDS Day about Black women and the future of sexual health. I want to come back to you, Linda, and just ask you, and have the doctors chime in as well. We hear this and we understand that there is a stigma. We understand that there is disparity when it comes to healthcare. But how do we reduce the stigma and normalize HIV testing, prevention, and treatment among Black women so that Black women are able to say, or they don't feel that stigma or that hesitance to actually get the help for themselves so they can, you can't get to the disparity in the fact that there's not adequate health care if we're not comfortable going and making sure that we get the education and making sure that we're healthy. So how do we start to change these stereotypes?
Well, first we start with valuing our health, and honestly, Black women do. Black women take care of themselves as best they can. And health is a priority. Often in the medical community,
Mm-hmm.
where it's not viewed that way. Doctors don't always think that we think our health is important. So one of the things that we have to do is, unfortunately, I hate to say this, sometimes we have to make our doctors do their job. So ask your doctor about, what are the kinds of comprehensive um, resources I should know about and take advantage of.
Mm-hmm.
We say this all the time in the cancer world. Ask your doctor, do I have cancer? And then the doctor will think, oh, right, we need to screen you for breast cancer and cervical cancer and colorectal cancer. Well, ask your doctor, do I have HIV? Because as much as we think HIV testing is a normal part of healthcare, it isn't for everyone. So make sure you get that test. Ask your doctor, well, how can I protect myself? So that your doctor, your healthcare provider will talk about pre-exposure prophylaxis, talk about prevention, but also, talk to your friends, because part of what happens is we create the stigma, as you mentioned, this mystique around HIV as being something that only certain people get, when in fact, if you're having sex, you could be exposed to HIV. So it is normal because sex is normal. And it is a virus, and you can prevent yourself from getting it, but you can also treat it as well, as we know, and you can become undetectable. So what we have to do is talk to each other in the way that we would do over a glass of wine after work, but also make sure that our healthcare providers give us the information we need. And then you have all of these resources that have just been mentioned, where you can learn the actual facts about HIV and how it's transmitted and who's at risk and what you can do to protect yourself.
Dr. Fanfare, I want to ask you in answering that, can you also speak to what are you hearing, in the work? You guys are both, all three of you are on the ground doing this work, interacting with women, interacting with doctors. What is the feedback that you're hearing from Black women about what those issues are, and how can we, as those of us that are trying to understand and make sure we have those conversations with our girlfriends, what are the key points that you're hearing in your work that make you say this is what we need to be doing as a community?
I really love this conversation, and I'm going to answer this question from both lenses. The lenses I've been introduced as with my job at CDC, but also as a clinician who treats women with HIV. And so I think when it comes to stigma, Linda really hit on something that I'd love to focus on, those conversations that we have with our girlfriends, but also us as the medical community. We really need to move the conversation away from risk towards pleasure. right? That's
Mhm.
how I understand things. That's how a lot of people understand
I
things.
like that.
When you talk about risk, people are like, you're not speaking about me or to me. But pleasure, that's something we can all understand when it comes to our
Mhm.
sexual health. So how do we
Mhm.
really pivot the conversation to start talking about pleasure? As I said, PrEP is an act of self-love. And if we're coming from that pleasure lens, I think it can really help in the conversations that we're having. At CDC, we have our Let's Stop HIV Together campaign, a national campaign. It has a lot there with how to reduce stigma, starting with the language that we use. It's so
Mhm.
important in the language that we use, even among our girlfriends. Sometimes someone might say something and you don't feel like it's a safe, brave space for you to be able to be your authentic self. So
Mhm.
really being concrete about the language that we use, and you can go to Let's Stop HIV Together for some of that information, I think would be really helpful. Other things that I'm hearing are, just as you alluded to, Crystal, people not thinking PrEP was for them, people not thinking HIV is about them. For my women who have HIV, how they want to be able to continue to get into sexual relationships, but so many people who they engage with, they don't understand undetectable equals untransmittable. They don't know
Mhm.
that you equals you, that if you are treated for HIV and virally suppressed, you cannot transmit HIV to your sexual partners. So there's still so much misinformation that we
Mhm.
have to do our part, both as clinicians, public health professionals, and Black women, so that we can continue to center and uplift each other.
I love that. I need to see more hearts in this comment. This is some great information. That was amazing. I love that. The idea of changing the conversation from risk to pleasure. That's huge because it takes away that stereotype and makes it relatable for everyone. Dr. Rice, same thing to you. What are you seeing? What are you hearing? And how can we start to bridge that gap?
I just another set of hearts to the comments that came before. I'm going to add that, I hear in some of the studies that we have done that engage women living with HIV as well as people affected by HIV in other ways, that one of the things that some people feel can contribute to the stigma that they experience when they're wanting to get tested, wanting to use PrEP, is some of the ways in which we have sort of separated in the past, historically, I should say, where people receive those forms of care, health care. And now I think there's a lot of options that people have and that we could be enhancing around where people are getting tested, getting PrEP, et cetera. So one of the things that I'm thinking about is just some of the limits that we have around who can prescribe and administer PrEP, and I think there's some work and advocacy being done to allow people to better, receive care at some really in innovative settings. So it could be a healthcare provider, it could be within your local pharmacy, but it also could be a mobile clinic or like a vending machine. There are a variety of different ways that people are gaining their access, that we are exploring opportunities to make sure those are affordable, accessible, and complement, some of
Mhm.
what has traditionally existed in ways that is, safe and effective. So I think that's one thing. And then otherwise, I just think there are ways that we could, once again, improve some of the comprehensiveness of sex education. I think that's one way that people will feel that these topics are less taboo. And there are also things that have happened, like criminalization of people living with HIV. We know that that is a something and a practice that contributes to stigma, but also makes it less likely that people use services, that they benefit from all of the different prevention tools that we've been talking about. So I think there's a lot that we could do to even structurally in terms of our policies that makes it easier for people to access care, to talk about these topics and more.
Well, I want to ask Linda, because I know Black Women's Health Imperative does so much to kind of bring these conversations to women, on a very real grassroots level. And I saw one of the comments that was like, we understand, love Dr. Fanfare's comment about risk to pleasure, but still, how do we as people that hear this information, how do we start these conversations with our girlfriends, and how do we get our community to speak more openly about HIV and sexual health and just prevention?
Well, I love that comment, and I'm going to use it. PrEP is self-love. PrEP is self-care, absolutely. we need to make sure that no matter who is speaking, from these people who are in positions of authority, whether it's your healthcare provider, your pastor, whoever runs the employee health clinic at the job, news people in the media, obviously journalists, speak about HIV as what it is. It's a virus, and talk about it in terms of health terms. Like it has no more valence on it than any other virus. It's a virus. We know how to treat it. We know how to prevent it. But from a woman's perspective, I love starting with self-love and pleasure. And the last time I read anything, I think sex is supposed to be pleasurable. And so if that's the case, then taking those steps to protect yourself from any kind of sexually transmissible infection is what you ought to do. We talked about chlamydia. There's so many others that we could talk about. So we have to normalize this in the conversation, in the context of health and pleasure, and also what we as Black women deserve. And I think we deserve to be healthy. I think we deserve to be happy. I think we deserve to be economically self-sufficient. I think we deserve to be valued and trusted in society. And all of that is connected when it comes to our health, and on this World AIDS Day, HIV. So if we can start having the conversation that way, instead of pulling HIV out as though it's something over here that we talk about, it is a part of health, it is a part of life. And if we treat it as such, then we can get rid of the stigma. We can then give women the tools. They can feel free to act on these tools and take advantage of what they can and what they have at their disposal to protect themselves and live as healthy as possible.
Absolutely. Well, again, kudos to the amazing work that Black Women's Health Imperative is, where you guys are an amazing resource for this. I know we are almost out of time, but I want to ask each of you this question, because we know we're here honoring World AIDS Day, educating, having this amazing conversation. So many people have joined, and I look forward to this being up on the pages so that people can listen to the replay and get the information. I will start with you, Dr. Feinfair. What do you see as the future of HIV prevention for Black women? We hear what we're talking about now, but what do you forecast? We talked about the statistics that were as recent as 2021, with us coming out of the pandemic, and Black women still leading in cases when it comes to U.S. women. What do you see as the future of HIV prevention for Black women?
Well, thank you so much, Crystal, and to my esteemed colleagues being with me here today on World AIDS Day. It's been so powerful to be able to share this space with each and every one of you. We've made real progress since the beginning of HIV, but these disparities that impact us as Black women are still so prevalent. We are 11 times acceptable. So one thing I would love everyone listening now or listening in the future to do is get tested, because knowledge is power. So please go to gettested.cdc.gov. You can get free confidential HIV tests sent to you, or find out where you can be tested close to you. That is the first step. And then from there, continuing to engage in these conversations around PrEP. Not only is PrEP available now as a pill, but also a long-acting injectable. I think as we talk about the future, there are other modalities that are coming out that might even be longer-acting injectables, not just for prevention, but treatment. Most of the women who I'm able to take care of as their physician are on one pill once a day. As I said, U equals U. Undetectable equals untransmittable. Our advocates, our activists, our Black community, our sisters have worked so hard to get us to where we can actually say ending the HIV epidemic is possible. So let's continue to do the work to make sure that we all get there together.
Dr. Rice?
I also am just so honored to be a part of this conversation with you all, and I'm thankful that we have everyone who has joined to be a part of it as well. I think I am going to echo a piece of what was just shared, as well as at least several of the comments in the chat referred to some of the innovative options that are being sort of furthered for people to do testing in ways that's simpler for them, from the comfort of their homes, for example. The options that are being created for PrEP, and areas where we can access both of those being diversified, not just within our homes, but in other places within our communities, I think is really critical. What I am hoping that we see is that the attention is not just on those innovations, but also ensuring that there aren't then further disparities in who accesses them, right? So just ensuring that those are affordable options, that people are able to get to them. And I'm just really encouraged by some of the ways that we're using, for example, right now, Instagram, but also a number of different platforms to have these conversations. And I just see that as such a tool to really just take the conversations into our own hands and share what we know and give the benefit directly to our communities. And we know it grows from there.
Absolutely. Linda, from your perspective with Black Women's Health Imperative, how can the community support the initiatives that you're doing? And can you share more about how Black Women's Health Imperative is a resource for women that may need to be tested or may need to, get help with their health insurance? How are you all impacting the community in that way?
Yeah, we want to make sure that every woman has the resources she needs to make those decisions, the best decisions for herself. I mentioned the On Our Own Terms, which is one-stop shopping. Whatever you need to know, you can find testing sites, you can find PrEP locations, you can find what you need to know to take care of yourself. I also want to mention the first ever graphic novel. I can't remember now, we're up to 12, 13, 14 issues, issues of this. Luna Unleashed, Luna, the super sex educator, who basically breaks sexual health down in terms that young people can really access it and understand it and know what to do. Nobody's ever done this. Nobody's ever talked to young people in the way that they talk to themselves to really understand sexual health and HIV prevention. But I think I want to close with, as long as we love ourselves, as long as we choose to love others, we are all HIV possible. And because we are HIV possible, there are things we need to know. There are things we need to do. You've heard a number of resources on this call. It's on our website. And Dr. Fanfare talked about a number of resources. Go to those places, go to those sites, follow us all on social media. You will have exactly what you need to know to protect yourself, to take the actions you need to take so you can continue to keep loving yourself, keep loving others. And we'll get to that point where we actually do end this epidemic and stop seeing the statistics that we've heard where Black women face such disparities in access to PrEP or treatment. That doesn't need to be the case. We deserve more. We are valuable. We are worthy simply because we did one thing this morning, Crystal. We woke up. So thank you very much.
That is a beautiful note to end this conversation. I want to thank you both. I think that we lost Dr. Rice, but I want to make sure that we thank Dr. Whitney Rice, who is the director of the Center for Reproductive Health Research here in the Southeast. Emory, they do so much amazing work there. Of course, Dr. Robin Nablett Fanfare, who has dropped some gems on us today. Thank you so much, Acting Division Director for the Division of HIV Prevention. And most importantly, thank you so much to Linda Gola-Blount, President for the Black Women's Health Imperative, and our partner for this conversation on Black women and the future of sexual health. We want to thank everyone that tuned in. If you had a chance to listen to this live, encourage someone to go back and watch the replay because it's so important. We'll have some information for you in that caption that you can look up. And last, before we get out of here, Linda, can you share social media handles and where people can follow and reach out to Black Women's Health Imperative?
Sure. Instagram at BLK Women's Health, at Black Women's Health, and oot.bwhi.org for On Our Own Terms, which is the one-stop shop for everything you need to know about HIV and testing and prevention. So thank you so much, Crystal.
Thank you. Well, happy World AIDS Day, and thank you all for joining. This is Crystal Jordan with Rolling Out, and it's been my honor to host this conversation. We look forward to seeing you all for more information over the next 4 weeks we have coming, and hopefully we continue to partner with Black Women's Health Imperative. Happy holidays, everyone. Thank you for joining.
Thank you.
Bye-bye.
Happy holidays.
Bye-bye.
Bye.